Now, China's tyrannical zero-COVID policy is reaching new depths as people in Shanghai, already locked in their homes under the world's strictest lockdowns, are now banned from getting food deliveries and accessing certain hospital services. Videos shared on social media show suspected COVID patients being forcibly quarantined. Look at this. Now, the head of the World Health Organization has issued a rare rebuke to China, saying its zero-COVID policy is simply unsustainable. I'm joined now by global public health expert, Professor Devi Sridhar. Devi, lovely to talk to you. Used to speak to you a lot on the morning show. Great to have you on Piers Morgan Uncensored. This zero-COVID strategy that China is still trying to follow, you were a supporter of this early in the pandemic, before vaccines came along. What changed your mind, and what do you think of what's happening in China?
Yeah, nice to see you again, Piers. I think early on, when we could see there were numerous vaccine trials and the early results were really promising, the idea of zero COVID was to buy time, because every infection averted could let someone live into an era of vaccines, therapeutics, and actually live for years and years to come. And I think countries like Taiwan, South Korea, New Zealand recognize that, have done mass vaccination and opened up. South Korea has no more restrictions. New Zealand is opening its borders. Unfortunately, China hasn't moved forward with mass vaccination, still has a substantial fraction of elderly and vulnerable people unvaccinated. And if it opened up the same way that other countries have, it would have 1.6 estimated million deaths. And so right now it's in a difficult position, because we know the true exit is science, it's scientific tools. But right now, China just doesn't have access to those, and the Chinese government is in a very difficult predicament.
Which country do you think has done the best? I read that Vietnam, for example, has had a really good pandemic, very low death toll, very high take-up on vaccines, etc.
Yeah, so I think the countries to look at are largely in East Asia and also in the Pacific, where they kept infection numbers low, but they didn't do that through daily lockdowns. They knew their economic and social performance would really suffer under that. So what they did instead was actually watch their borders, limit importation, have a great testing and tracing system, and therefore suppress, then mass vaccinate as soon as vaccinations became available, and then open up now back to normal. And so they've taken a wave of infections in many cases, but the damage has been blunted because of the protection we now have through the scientific progress over 2 years.
I was very critical of the British government in the first couple of waves of this pandemic. I felt they handled it really badly. I think you shared that view at the time. When you look now 2 years on, you see the overall death rate now around Europe, for example, and the UK hasn't fared too badly because of the success and speed of our vaccine programme. So when you look at it in totality, what would your verdict be on the way the UK government has handled this?
Yeah, I think you're exactly right, Piers. We have to look at pre-vaccine, where we saw in the first year a lot of lives lost unnecessarily, mistakes made in delayed testing, not having any checks in terms of people entering the country during our first lockdown, very delayed lockdown in several cases. But actually, when you hit 2021, the rollout was pretty superb and stellar. I think many places looked at Britain and said, wow, how did they do that? And that really credit goes to the UK government for getting the supply of vaccines, but also the staff of the NHS. We know people were there and working 24 hours on the weekend to get vaccines and jabs into arms, but also the British public. The vaccination rates are absolutely astonishing, which means people showed up. They knew it was something they could do to help us exit this pandemic, and they got not one, but two, but three jabs, and that's why we're able right now to have as much freedom as we do in our daily lives without the devastation that we're seeing in other places.
Final question, and it's a contentious one, because when people aired the theory that COVID began in a lab and not a wet market, they were sort of taken off social media and howled and abused and so on. It's becoming a much more popular theory. What do you think?
Well, I think there's, when initially people talked about lab leak, they talked about some kind of bioweapon. And I think virologists are clear this was not designed by people. This is natural in terms of its origin. Where there's more debate is, when did the spillover event happen? Did it happen in a wet market, or did it happen through a lab leak? Knowing that lab leaks happen all the time in different places across the world, and the Wuhan Institute of Virology does indeed do research on coronaviruses. So I think the jury is out on this, and what you've seen is this becoming quite political, with the WHO, the World Health Organization, just unable to get an independent mission in to do an audit of that lab to actually look for reservoirs of where could this virus be in terms of an animal population. So we just don't know, but it is an open debate, and I think there are arguments on both sides of that debate.
Devi, it's great to talk to you. You've done a brilliant book called Preventable. It's really about how we avoid getting ourselves into this kind of situation again. It's very hard because we never know where the next pandemic may come from. But great to talk to you. You've taken a lot of flack for your positions that you've taken, but I've always felt you followed the science. You've changed your view when facts have changed, and I think that's what scientists should do. So I thank you for everything that you've done, and good to talk to you.
You too. Thank you so much, Piers.